Yeah. So
That's it.
That's good.
That way?
Just into the microphone.
Into the mic. Oh, I'll be right on top of them. How's that?
That'll work.
Can you hear me?
I can hear you.
It's not on.
Oh.
It's a good start.
No, it is on. Yeah,
Okay.
typical for Orange. Right, here's the problem with this duo.
You're not, are you, Rory?
No, not at all. Ready for a level check, Jill.
Okay, Jill Ludford, Chief Executive of the Murrumbidgee Local Health District.
What are we doing here today?
Okay, well, we're here today because it's really exciting that we are now able to announce that we will be a regional vaccination hub for the southern part of New South Wales. Our role, though, is really clear in this Australian government-led COVID-19 vaccination strategy. It is important we understand that our Australian government is leading the vaccination of our whole community, which is a really exciting step now in the evolution of this COVID-19 pandemic. So what's our role? We will create a vaccination hub here in Wagga Wagga, and our responsibility is to vaccinate all the healthcare workers in the region, as well as vaccinating our aged care residents in our own Murrumbidgee Local Health District residential aged care facilities, and also our own aged care staff as well. So the rollout across regional New South Wales is commencing, as we heard from the Premier, from the 15th of March, and we'll let you know when our date gets closer as soon as we know from the Commonwealth Government. So an immense amount of planning has been undertaken by our teams over the last few months so that we know that we are now ready. So we have to obviously ensure that we've got the appropriate facilities for the storage and handling of this very, very precious vaccine. And also we need to make sure that we've got appropriately trained and credentialed staff. So that's all happening, and I'm pleased to say that our staff actually travelled up to Sydney. We have 3 fantastic vaccination hubs operating in Sydney at the moment, who are really vaccinating large amounts of our healthcare workers every day. There are 3 hubs in Sydney and Liverpool, RPA in Westmead, and our Murrumbidgee team visited that Liverpool hub on Monday. That's great for us. We've had lots of opportunities to look at the lessons learned and make sure that we can streamline our clinic as we open it up here. So the clinic and the hub will be based at Wagga Base Hospital, and we will then have what we call mobile teams who will take the vaccine out to the spoke sites from the hub, and those spoke sites will actually be all of our 29 other hospitals across the region, and we will do that over a period of time. So the message today is we've been planning, we are ready. We are still awaiting our final date from the Australian government, but I just want to reassure the community that your healthcare workers in our region will soon be vaccinated, along with the highly vulnerable aged care residents that we are caring for. And clearly we're working closely in collaboration with the Primary Health Network and the other providers from the Commonwealth Government who are providing vaccination across our region.
So the frontline workers will be the first to get vaccinated in our region?
The healthcare workers will be the first people to be vaccinated by the state in our region. There is already been vaccination of aged care residents in our region by the Australian government. That's already commenced.
How many people are you expecting to vaccinate a day in this Wagga hub?
Look, we're still working out the details, and a lot of that will depend on the amount of vaccine that's made available to us from the Commonwealth Government.
With the hub system, is that purely so you can store a large amount of vaccine in that cold storage before sending it off? And how long can it be, I guess, travelled to our spoke sites?
Well, obviously there are a number of different vaccines, and the Pfizer vaccine, which is the one currently being used for healthcare workers, has got very particular properties in terms of storage at minus 70 degrees, which is indeed why we are establishing the hub here at Wagga Wagga, to ensure that that storage can be guaranteed. However, the Thord vaccine does have a short life where it can travel, but again, we need to very carefully monitor cold chain travel time, and make sure that we absolutely use every drop of it with no wastage.
What sort of time frame are you looking at from sort of start to finish of being able to vaccinate your workforce and people in your residential aged care facilities?
So the time frame that it will take will be highly dependent on the amount of vaccine that is allocated to us from the Commonwealth Government.
Do you have a rough idea of how much you'll be getting initially, and when would you know that?
So we are awaiting further details, and this is a campaign that's happening right across Australia, and the Australian Government are leading it, and as we receive further information, we'll certainly let you know.
Is there any idea when you'd expect to get that information for that first initial sort of how much you'll get?
So we'll keep you briefed. It's just important to know, I think, for our community and our healthcare workers that we are ready, and we are really waiting for that vaccine availability from the Australian Government.
Do you know how many people in our residential aged care facilities here that have already been vaccinated in the MLHD so far?
So we don't have a role, the state doesn't have a role in the vaccination of the not-for-profit and private aged care facilities in the region. So I don't have any real advanced knowledge of where that vaccination is going to be undertaken. The Primary Health Network, though, who are overseeing that process, work very, very closely with us. And I think the providers who are doing that work are very much under the same process that we are. It is all dependent on the amount of vaccine as it comes into Australia. And we've heard some really positive news in the last few days. So there's been another arrival of Pfizer vaccine into the country that's currently gone off to the TGA for approval, and also the AstraZeneca vaccine has now arrived in Australia and will be available in much larger quantities, and again that's gone off to the TGA and has received provisional approval. So I think a message for everybody is there will be plenty of vaccine, and as it arrives, we'll just be fluid and flexible in our planning and make sure that we can get it out in a timely way to the maximum amount of people. And again, the state and the Murrumbidgee Local Health District is only responsible for the vaccination of the healthcare workforce and our own aged care residents and aged care workforce staff.
There's obviously for people from the Holbrook and Culcairn areas wanting to get the vaccinations, where do they go? Do they go to the Albury-Wodonga Health or MLHD?
So I've been working really closely with Albury-Wodonga Health. I meet with them each week, and they have been fantastic in collaboration. They have agreed to vaccinate the healthcare workforce who live in the Albury City Council area, and also paramedics who are in that region. So they will be vaccinating people just in that Albury City Council region.
So does that mean those from Culcairn and Holbrook will be coming to here?
We have factored in, so the way that it works with the hub site, our travelling teams will take the vaccine out to each of our smaller hospitals and vaccinate the staff, if they have residential aged care, also the residents in the facility. And also, there's a large amount of healthcare workers. We've got to think about our COVID testing clinic providers, our pathology providers, our respiratory clinic providers. So all those people come into that bucket of healthcare workforce. Yep.
Will it be mandatory for your staff to be vaccinated?
So it is not mandatory for healthcare workforce to be vaccinated. However, it is highly encouraged. And we have had some really great feedback from people so far who are really showing an enthusiasm and an excitement in this next step in protecting themselves, their families and the community against the COVID-19.
There's obviously still some people who are a bit sceptical about the vaccination. What kind of impact will it have not having everyone vaccinated? There'll obviously be some who will refuse it. Is that going to change the way it works, or?
Obviously, the more people that are vaccinated, the better. And the beauty of the COVID vaccine is its whole purpose is to reduce the number of people who become symptomatic and the number of people who will end up in our hospitals. So the more people right across the board, whether it's healthcare workers or community people who can be vaccinated, the better that it will be in terms of managing COVID-19 into the future.
And any message for those who might be sceptical?
I might get Dr. Bruce to answer that question as a doctor. I'll hand over to Len.
So as with most viral illnesses, the only true way to protect you is through an effective vaccine, and we've been very lucky that there's a large number of effective vaccines currently available. And I think it is important to understand what the aim of vaccination is. As with influenza, the aim of vaccination against COVID is to prevent severe illness. In other words, where patients need to go to hospital, they may need admission to the intensive care unit, or sadly some patients may die from the illness. And from the data currently available, it appears as if all the vaccines are equally effective in preventing those severe outcomes, which is good news for us, and it's a tremendous achievement by the healthcare system internationally to be able to produce such effective vaccines in such a short period. I think the other thing to remember is that there is some preliminary data that shows that some of the vaccines can prevent transmission. So the way for us to keep the community safe is to have as many people as possible vaccinated. There could be a small group of people who could for some reason not get a particular vaccine, but they may be able to get one of the other vaccines. So it is important that we work together. And even though it's not mandatory, if I look at the number of questions I get about people who want to have it done, I think the uptake is really going to be great.
How many people have undergone the training to administer the vaccine?
So all our staff, and I sadly don't have the exact number, but all our staff will be delivering the vaccine has completed the mandatory training.
So we have over 100 trained vaccination nurses, and also pharmacists also play a really important role in the rollout of the vaccine clinics.
And I know that some of the general practices have started their training as well. So, I don't think we'll have a problem of having a well-trained, skilled workforce to deliver the vaccine.
And where is that at? So, because obviously there will be that GP-led aspect of it down the track. And will that be quite key in getting it out to a lot of our smaller centres as well?
Well, I think the vaccination of the broader community will be managed by the Commonwealth through the PHNs in collaboration with general practitioners, and there's discussions about pharmacists as well. But once again, we need as many people as possible participating to ensure we can vaccinate the largest group of Australians in the shortest period of time. But as the Chief Executive has mentioned, most things will now rely on the availability of vaccine, because we've only really had relatively small quantities coming to the country. It's obviously good there's more coming in, but I think a lot of that will depend on the availability of vaccine. But rest assured that when vaccine becomes available, there'll be more than enough skilled, well-trained people to deliver your vaccine safely.
And people at home, what do they need to know about? Will they be told when they're eligible for a vaccine? Because we've had some people saying, do I need to keep hounding my GP asking when it's my turn, or will they know?
No, so in terms of our staff, we will contact our staff who's eligible for vaccination, and we don't know what the process will be, but I would expect that there'd be more information going out to the public as more vaccines become available, but currently we don't know, and the GP sadly won't know at the moment as well.
Thanks very much, Lee.
Okay.
See you later,
Alrighty.
guys.
Thank you very much, Lee. Thank you.